Today, we're going to discuss a few frequently asked questions that come in from the field from employers and employees regarding occupational medicine. Toby, a CDL driver, asks, "In my state, marijuana is legal, and I have a medical marijuana card. Is that an issue when getting my DOT physical?" Actually, Toby, that is an issue when getting your DOT physical. As of now, marijuana is still a Schedule I drug with the federal government. That overrides the state because your license as a DOT driver is federally regulated. So essentially, you have to choose between your CDL med card and your marijuana medical card. Jill, a food manufacturing assembly line worker in Pennsylvania, asks, "I got injured at work. Do I have to go see the doctor that my employer tells me to?" Great question, Jill. Work injuries are regulated by individual states. In your state, Pennsylvania, employers have the option to post a work comp provider panel. If they follow that rule and post the panel, you must see a provider on that panel list for the first 90 days of your injury. If your injury remains after that 90 days, you can choose a provider of your own choice. However, if they choose not to post the panel or don't provide it to you, you're able to select a provider of your own choosing. William, a construction worker, asks, "I cut my finger at work and just put a Band-Aid on it to stop the bleeding. Do I need to report that to anyone?" Well, William, it's important to remember that any injury that occurs at your employer should be reported to your direct supervisor. The reason being, work injuries have to be recorded or documented. If your injury would get worse and you didn't report it, it would be difficult to obtain care later on. Also, employers have to keep track of their injuries, and certain injuries that require more than just first aid could result in an OSHA recordable. So it's important to keep your employer informed for both your care and their ability to comply with federal regulations. Tabitha writes in, "I've been picked twice in the last 2 months for random drug testing. Is that possible?" Excellent question, Tabitha. While some drug testing, like DOT drivers, is federally regulated, non-DOT testing is subject to state, local, and employer rules and regulations. So, depending on the size of your workforce and the pool that you're being picked from for a non-DOT test, it is possible that you could be selected twice in 2 months. Alexis, a powdered metal press operator, writes in, "I have to wear hearing protection and a face mask at my job. I'm pretty sure these are OSHA things my employer is making me follow, but they told me I have to get tested for them on my own outside of work. Can they do that?" Great question, Alexis. If your employer is required to follow hearing conservation and respiratory regulations, then no, they must allow you to both submit annual questionnaires, receive training, and have testing completed during normal working hours. However, if they're doing it as a precautionary measure and they simply want you to have the testing, they could advise you to have those things done on your own time. However, they would also have to make it clear that this is optional and not due to OSHA regulations that they are subject to. Thank you to everyone who wrote in. We're glad to help you answer your questions. If you have more questions, feel free to drop us a line in the comment section below or email us at info@cnsoccmed.com. Keep the questions coming. Thank you.